Welcome to Vikas Learning, where we are making learning new and different.
In this session, we are going to learn what is fee schedule and fee for service, FFS.
A fee schedule in healthcare is a comprehensive list that details the prices or fees charged by healthcare providers for specific medical services, procedures, tests, or treatments. It's a tool used by healthcare professionals, medical facilities, and insurance companies to establish the cost of healthcare services. Each item on the fee schedule usually comes with a description of the medical service or procedure it represents, helping patients and insurance companies understand what the fee is for. The fee schedule includes the price or fee for each service listed, which could be a fixed amount for standard procedures or a range of fees for more complex or variable services. One of the crucial roles of fee schedules is to determine how much insurance companies will reimburse healthcare providers for services rendered to covered individuals. It's common for insurance companies to negotiate fee schedules with healthcare providers as part of their contracts. Fee schedules also provide transparency for patients, enabling them to understand the cost of medical services upfront. This transparency can assist patients in making informed decisions about their healthcare and financial planning. In some instances, fee schedules may be regulated by government agencies or professional organizations to ensure fairness and consistency in pricing. For instance, Medicare and Medicaid have their own fee schedules for reimbursing healthcare providers. Fee schedules may undergo periodic updates to reflect changes in medical practices, technology, or economic factors. It's necessary for providers and insurers to keep their fee schedules current to accurately reflect the costs of services. In summary, fee schedules in healthcare are vital for determining the cost of medical services, facilitating insurance reimbursement, and promoting transparency in healthcare pricing. Fee-for-service, FFS, is a healthcare payment model where providers are paid for each service they perform or provide to a patient. In this model, every service, test, procedure, or consultation is assigned a specific fee, and the provider bills the payer, often an insurance company or government program, for each service rendered. Providers are reimbursed based on the number and type of services they deliver, regardless of the outcome or quality of care. Each service has its own fee, which can vary depending on factors such as complexity, location, and provider specialty. Fee-for-service allows patients to choose their healthcare providers and services without restrictions from insurance networks. Providers also have flexibility in determining the services they offer and the fees they charge. Critics of fee-for-service argue that it can incentivize overutilization of healthcare services because providers may have a financial incentive to perform more tests, procedures, or visits than necessary to increase revenue. Fee-for-service payment models can be administratively complex for both providers and payers. Providers must keep track of the services they provide and submit claims for reimbursement, while payers must process and adjudicate these claims. Since fees are based on individual services, the total cost of care can vary widely depending on the number and type of services received. This can lead to unpredictable healthcare costs for patients and payers. In recent years, there has been a movement away from fee-for-service towards value-based care models, which aim to incentivize quality and outcomes rather than volume of services. However, fee-for-service remains common in many healthcare systems around the world. Overall, fee-for-service payment models provide flexibility but can also create financial incentives that may not always align with optimal patient care. To address these issues, efforts are being made to implement alternative payment models that reward value, quality, and efficiency in healthcare delivery.
Thank you for watching.